Welcome back, everybody, to Leading Experts. I'm your host, Grayson Foster. If you're just tuning into the show, my guests today are two of the top cosmetic and restorative dentists in Plantation, Florida, and they're also father and son, Doctors Marc and Eli Schwartz. Dentistry has been a tradition in this family for over 100 years, which is really unbelievable. We talked about that a little bit earlier, gentlemen. And since we're talking about your family, I want you to talk about your wife, because you've certainly done some dentistry on her, right?
I have.
Okay.
My wife is just like every other person that wants to look and feel better, and we have done every kind of procedure for her. We've done veneers on her, we've done crowns, and she has a similar problem that many people have and that people could relate to. You've had work done and maybe something happens to the tooth.
Right.
Maybe you've had a root canal and the tooth cracks, or for some reason you lose the tooth. So she was actually one of the first people that I placed and restored implants back in 1986. That's a trust.
Yeah, no kidding.
Anyway, the fact is that today those implants and crowns are still functioning like the day we put them in. So really, you can see how implants can really last a lifetime if maintained, and she's just doing fine.
And if she wants to complain, she doesn't have far to go, right?
Exactly.
Yeah.
To him.
Yeah, not to you, but to you. All right, the next patient we're going to talk about is a gentleman that had a terrible motorcycle accident. This is really an incredible story. Tell me about this patient.
Yeah, Frank goes back a long way, and he had a lot of problems after this accident where his face was actually smashed in. And this is, of course, I understand, an extreme example, and not everybody is going to be having motorcycle accidents, but it shows you how much implant dentistry can really do for somebody.
Okay.
For years, he walked around with a removable partial denture for his front teeth because his face was actually smashed in.
Wow.
And maybe 15, 16 years later, after multiple surgeries, he was actually able to have his jaw move back out. And at the same time, the surgeon placed implants in the new bone, and then we were able to restore him, and he looks pretty happy now, and he's got teeth that stay in.
What a gorgeous smile.
You would never know.
And he functions great. As a matter of fact, he came out so nice, his wife came in and says, geez, can you help me improve my smile? And we did a smile makeover on her also.
Aw, that's amazing. He's lucky to be alive.
He is.
Wow. All right, your next case here is Ray. Tell me about him.
Well, Ray had some issues with some of the teeth on the lower part of his mouth. It's hard to see in that picture, but, you know, even at his age, he looks and feels great. And he didn't want to have to wear something that came in and out of his mouth.
Exactly.
Okay, so he had to lose some of the teeth right here in the front on the bottom, like a lot of people have as they get older. And instead of wearing a partial denture, he had implants placed. And now he's walking around, he's got beautiful looking crowns on the bottom that function normally, like teeth.
Right.
Yeah, and he never has to wear anything that comes in and out of his mouth.
Just in case someone is tuning into the show just now, let's go over the importance of replacing missing teeth. I think a lot of people just think, oh, well, I'm missing a tooth or I'm missing a couple teeth, it's no big deal. But what can happen to your face and your overall health if you don't replace those missing teeth?
I think a lot of times people don't understand. They think if they lose a tooth and nothing bothers them, they don't have any pain, it's just a space, no big deal.
Right.
There's no other things going to happen, they just have a space. But what happens is teeth are not like static, they don't just stay where they are. Teeth are constantly moving as we age. So when you lose a tooth, not only is that tooth lost, but the bone that used to hold that tooth goes away, and the teeth around it start to shift to fill in that space. So it becomes sometimes more difficult to clean the area. Okay, it can lead to other issues with the gums, the other teeth when they move, and then when they get older, say that maybe they decide, you know what, I don't like it, I want to do something about it.
Right.
The treatment at that point becomes more difficult than it would have been if they just at the time it occurred, if they just would have done the simple thing and replaced the tooth, then all that stuff would have been, you know, taken care of.
Right.
You know, life is a balance.
Right.
Everything in life is a balance, including your mouth. When your mouth is out of balance, it's like having a thorn in your foot, and all of a sudden you hop, and then all of a sudden your hip goes, and everything is out of whack. Life is a balance, teeth are a balance, and when you keep things in balance, you function better, and you feel better. And the worst thing someone can ever say is, geez, I wish I would have done that before. Because you can take care of it and keep things healthy.
I'm sure you've experienced that in your practice, in your years of practice, where someone has just ignored it for many years and then finally came to see you. Is that the case with some of your patients?
See it all the time.
Yeah.
One of the good things, though,
See it all the time.
isn't it great that today, though, people that have made bad decisions in the past,
Right.
we can now offer them, because of implant dentistry, options that even 5 years ago we didn't have. They'd be walking around and they're so sorry, go, well, you know what? Things are good today because we can now offer you this.
Yeah.
And it really has changed the whole aspect of dentistry. It's another source of treatment possibilities to get people back that more healthy, youthful, invigorating, strong bite and smile.
I think people just don't realize there's almost nothing that happens that can't be fixed with the advances that have been made. So
You're both very passionate about dentistry. I can see it. I can see why it's been in your family for 4 generations. What do you really want people to know about the importance of not only looking after your mouth and the health of your mouth in general, but also implant dentistry? What do you really want folks to take away from today's show?
I want people to know that they may be happy when they function well and they feel good, but we feel even happier when people come in year after year after year and we see the work that we've provided them looks as good in 5 and 10 years as it did the day we put it in. Because that's what we do. We help people achieve their goals, and we're proud of that. And I don't think it's as easy as just 1, 2, 3. We work hard to do that. And we get nice results. And I think some of the things that people have said show what promise we can give to people.
I think dentistry is not necessarily about teeth, it's about people.
Right.
Okay, so if you do things to help people achieve what's best for them, they'll like you, you'll like them, and that's what it is. It's about people more than it is about teeth.
Excellent. On that note, we're going to end it. Thank you, sir, for coming in.
Thank you.
Yeah.
Nice to see
meet
you, doctor. All right, thanks for watching Leading Experts, everybody. Bye-bye.